Welcome to everyone who has joined us for our third webinar in the Contemplative Medicine Conversations series. My name is David Iozzi. I'm the Director of Studies at New York Zen Center for Contemplative Care, and I'll be facilitating this evening, along with our online programs manager, Mayar Hasid, who you can chat if you have any technical difficulties with the Zoom. Today, the co-founders and co-guiding teachers of the Zen Center, Sensei Chodo Robert Campbell and Sensei Koshin Paley, Sensei Chodo Robert Campbell and Sensei Koshin Paley Ellison are joined by Reverend Cynthia Carter Perrilliat and Dr. Jasmine D, two of the visiting faculty in our upcoming Contemplative Medicine Fellowship. Jasmine is a sociologist and PhD from Stanford University, whose scholarship focuses on the causes and consequences of social mobility for Black Americans. And broadly speaking, her scholarship and teaching interrogate the intersections of inequality, racism, class, and culture. And Reverend Cynthia is co-founder and executive director of the Alameda County Care Alliance Collaborative, a faith-based program in partnership with local clinical, academic, and community organizations. She has over 25 years experience as a change agent in healthcare, marketing, and communications, as well as biotechnology and community organizations. Quite a range. So this third event is called the Medicine of Community, and we'll be exploring the role of community in alleviating suffering and promoting collective healing in our strained healthcare systems. So just a note about the format: the first part of the evening will be a free-ranging conversation between Cynthia, Jasmine, Chodo, and Koshin. I won't be posing questions as you might in a panel format, so they'll be guiding the conversation themselves. And then towards the end, we'll have a period where you can pass questions to us, and throughout the webinar, you can send those to us in the Zoom Q&A feature, and we'll collect those and then bring them forward towards the end. So Cynthia, Jasmine, Chodo, Koshin, welcome. And perhaps you could begin by sharing a bit about how you all find yourselves here together, talking about contemplative medicine and what that has to do with the medicine of community. Koshin, I think you're muted.
What a wonderful question. What do you think? What brings us here, Cynthia?
Thank you so much, Koshin, and thank you, David. It's such a pleasure to be here with all of you. What brings us here today? I think I would start out by simply saying it is our united opinion, our united attitude, our united deep desire to have all people have a sense of value, of worth, of significance. I think that the time that we're living in the country, particularly now in the United States and even across the world and around the world, I think it's a moment that I am just thrilled to be in this space with each of you because it is significant. And I think that people are listening now more than ever because of COVID-19, because of George Floyd and the racism and systemic racism that many of us have known about for years, and others are really just beginning to have their eyes and ears open to. So I am thrilled to be in this space with each of you to further collaborate on this incredibly important subject matter.
Can I just add quickly, David, thank you so much for those wonderful introductions. What was left out of the introduction, but we're always elated and ecstatic to share, is that the wonderful, well, to my right, but the wonderful woman to my right is my mother. So that is the other connecting fiber. So this is a wonderful, what I'm excited, a meeting of the minds of different disciplines and perspectives and approaches to the work, and also for us a deep conversation that feels reminiscent of the conversations we have around our kitchen table. So we're really grateful and have found such community with you, Koshin and Chodo, that you all are just extensions of that kitchen table for sure.
Indeed.
So, but I do also want to say, for myself, I feel so honored to be in this space. And perhaps maybe for some, I might be the unconventional voice in the room, which I have to just commend the work that is happening through this fellowship and through the Zen Center of the myriad of perspectives that are coming here. And the thing that I always immediately found home with people who are thinking about dignity and care and medicine and all these things as a person who studies racial inequality. And the reason why I find such a kindred spirit and a home is for those of us who, whether through our research or through our activism, are fighting for racial justice. What we share is this bond where all of us value so deeply human life, and we want all to experience it to its fullest. And that the end of life experience is a beautiful prism through which to both look at the beauties of humanity and also the inequalities that many folks in our society experience. And so I'm so grateful to be a part of that conversation, but that is the through line for me of how I come to this conversation.
I thank you both so much for lifting the topic of racial inequality. I mean, it stems and scans so far across the globe, you know, and as much as we may not like to think about it, it exists in our healthcare system. You know, we know that if a person of color enters the emergency room, likelihood is that they will be seen as drug seekers. They will be given less painkillers. They may be left till the end of the line. If the doctor or the doctor or the attending perceives them to be different to themselves, and at most it's called unconscious bias for the most part, maybe. But a white doctor may give preferential treatment to a white patient, a white person entering the emergency room. So we have to look at this, we have to really look at this in the face and admit to ourselves as clinicians, as doctors, nurses, social workers, that actually it's true. This does happen across the board. And so an important part of our program moving forward for the next year is to look at this kind of thing, is to look at not only how we don't care for ourselves as much as we should be doing, looking at our own shit, how we don't see other. You know,
Yes.
or we see other as different. And so a part of our journey together is to look at how we see this no separation. You are me, I am you. I see you through me. You see me through you. You know, it's a really important piece of work that we need to do, that we need to look at in this country and across the world. In this country in particular right now, and what is going on. So many beautiful voices coming to the forefront and saying, you know, no more. So it's a live moment. It's very alive. I'm loving it.
And I'm just so excited to be together. I think one of the reasons that we're together is because there was this immediate, at least for me, this immediate sense of love and connection between us, and a recognition of this real value of what community is, and how do we create actual circles of compassion. So like right behind us is Avalokiteshvara, the Bodhisattva of Compassion, that, you know, which is the work of what we do when we see something wrong, when we feel something off, when our empathic response is like, oh, what do we do with that? And that's for us the bridge, the important bridge of compassion. So in our activism, and for us, so much of our activism is directly through education, and really thinking about actually how having and convening circles to actually have meaningful conversation is a form of activism, to say that something is off in our community, in our wider community, in our small community. Still waiting for the invitation to that kitchen table, but that's and what's for dinner? Like, just to appreciate, like, how do we really set the table?
Yes.
With that, so that we can have not only meaningful conversations and meaningful, depth of conversation around dignity and respect for all beings.
What's the food on the table? Right.
But the food is also like, how do we really prepare that to actually be nourished? Because so many of us doing this work can get so depleted also in doing the work. So how are we really nourishing ourselves and each other? And the other thing I was thinking about, there's this image in Buddhism that I've always loved very much. There's these little beings called hungry ghosts, and they're like really, really hungry all the time. And they have this little skinny neck and a big belly, and they're just like, nah, really hungry. And someone brings them into this room where there's all these hungry ghosts at this table, and their arms are tied with boards, and there's all this delicious food in front of them, and they're trying to put it in their mouth, but they can't. And the person says, what kind of place is this? And the person said, this is hell. And they go into the next room, same deal, long table, delicious food, all the hungry ghosts of the boards, except they're reaching across the table and feeding one another. And so, like, to me, it's like that recognition that we have to get out of our status quo, of our self-interest, and to, even though it's also important to care for oneself, but for us, it's to really care for community, is to reach across the table and say, I want to feed you too. You exist, and you are real, and you matter. So,
what profound words. Absolutely profound, Koshin. If I could just piggyback on your words, and I wrote down the quote, out of our status quo of self-interest. I mean, when I began to really reflect on those words, and I think about my colleagues that are clinicians, and I am not a medical doctor, but I work very closely with physicians and clinicians in the work that we do in the Alameda County Care Alliance, in really partnering with health systems. I have to be honest with you and tell you that in many ways, my heart goes out to these incredibly dedicated people that have, just so much of their lives have been devoted to the care of others. And obviously going through the rigor of medical school and residency and everything that they go through to prepare themselves for the specialties or the general focus of their practices and so forth. And I'm always drawn to the fact that these people are so incredibly dedicated and have meaning. It brings meaning to them to bring no harm to individuals. And they really mean that sincerely. But I'm also in the space of discussion with them that says, how do we make a difference in medical schools and places of learning that are so geared to the scientific? And of course, we need the scientists. We need the scientific of this space. But I'm challenged when I hear their stories about how there's so little discussion about themselves as individuals and the significance and the meaning of themselves from a holistic perspective. In fact, that they are indeed spiritual beings and that they are indeed, obviously mental and physical, but the spiritual component that I think all of us know this deep significance of, and the lack of tending to that spiritual tends to continue to deplete us as human beings. And therefore, we don't tend to have that extra that we need to be present, truly, truly present with others, because we ourselves are depleted. I'm just curious in what you all think about that notion. And that's one of the reasons I'm so thrilled about this contemplative opportunity in this space, to really connect with people that are providing this essential care and let them know how much they matter.
One of the, thank you. What we often ask and what we notice sometimes is when we bring in the word spiritual, there may be like a step back from the scientists, maybe a step back. So what I often say is, what gives your life meaning?
Yes.
To me, that is the spiritual question. What gives your life meaning? And so many folks in all walks of life have no idea, or they've never really thought about it, because they're just doing what they do. They're doing their life.
Yes.
So when I say things like, well, how about your kids? How about baseball? How about walking in the river, swimming in the river, walking in the park? And people will say, oh my gosh, I never thought of that as meaningful. It's just something that I do.
Mm-hmm.
And then when in turn I say, that's a spiritual practice.
Mm.
Walking in the forest, swimming in the river, holding your kids. Of course, everybody loves their kids, but to see it not only an act of love, but an act of spirituality and connecting to another human being in a very, very deep way. And how can we do that to our patients? How can we cross that line from just seeing the diagnosis, the prognosis, whatever it is on the chart, to what gives your life meaning? There was a study done some years ago in Canada, and 85% of the people that were interviewed, when asked what they would have wanted, what more would they have wanted from their physician, the answer was, I wish they had asked me what gave me meaning.
Mm-hmm.
What was my spiritual life? And that's a pretty high percentage of people that wish their doctors would enter into that conversation. And we know that doctors are not trained to do that.
So far.
So our program is about how can you gently approach that without getting into some theological arguments, ideas, just what gives your life meaning? It may be my cats. My cats are at home. I'm here in the hospital. I know they're being taken care of, but I just love them so much. They bring love and joy to my life. Spiritual. What's not spiritual about that?
What you all just said is so interesting. I'm also though empathizing with the physician, with the activists, because like burnout for all of us that are in these roles of trying to be servants to our communities, the idea of asking ourselves what brings meaning to our life, I think we can hear it as selfishness. And you all are enforcing that this is, the furthest thing from the truth. And it reminds me of just an aha moment I had a few years back, which is, that the golden rule, which says treat others how you would want them to treat you, implicitly implies, like demands, high self-regard. It's implied in the statement, how you would want others to treat you. I mean, it's like, so therefore you've asserted how you want others to treat you, right? It's implied in that. And so much of the servant model in terms of thinking of what we do for others, I love how the conversation is centering back on, but you first, so that you have the reference point on how to give and to share with others. And your question around what brings you meaning, I love. The question I've been thinking a lot about is about what's your own definition of freedom. And even as you were talking, I was thinking, I was like, interesting. So for those clinicians, I'm like, it's almost a question. You were getting at things like, what would you do if there was no sickness? Like, what do you do? Like, who are you? What do you do in that moment? Where it's with your kids, it's with your cats, it's what, you know, or whatever it is. You know, for me, I found that it's like, strangely enough, it's like about interior design. I'm like, I love beautiful things. And I'm like, oh, that's interesting. Like, so who am I without, you know, without always focusing on, you know, solving a problem? You know, I am a person who loves bringing about beautiful things. And it's like, oh, that is totally different from my day-to-day, and that's okay. But I just love that this reframing and this refocus on, yes, it starts with you, and there's nothing wrong with that. It actually, compassionate and community building insist upon it. It insists upon it.
You know, I just keep thinking about that dinner, but I'll also answer the question.
Are you hungry?
But also just thinking about, you know, just the word, the very intentional pairing of 3 words of contemplative medicine and fellowship.
Mhm.
For me, it's like, you know, how do you actually contemplate to make the space? How do I do that? How do you do that? Because the shadow of that, of course, is that we don't do it. We don't make the time to, and we actually embody the time, even if for 1 minute. And so contemplative, so having that time to actually, what, as you're sharing about meaning, like how am I actually living what I actually say I value? So again, kind of moving into the compassion. So the contemplating, like, am I actually doing what I say I value? My actions. And then to think about medicine, like, what does medicine actually mean? It's not a bunch of pills, but what actually, you know, and from a Zen perspective, is that we talk about that the whole world is filled with medicine and poison, and that the poison can turn into medicine. So it's like our inattention even can actually become the medicine we need to, like, if we just contemplate it, it's like, all right, I'm not paying attention. So the medicine I need is attention. So the thing that's what we call problems, or we're talking about racism, right? And so anti-racism is the medicine, you know, so like to actually, everything has the other side, and the willingness. And to me, the only way to do that meaningfully, and actually, I often think about sustained change. Because it's really easy, like the world is filled with self-help books, and that might be really interesting, or weekends. Remember when people used to go away for a weekend and do things together in ancient times? And where they say, like, transform your life in a weekend, and then it doesn't stick, you know? But those kind of workshops are really popular, but they don't work, because it's for me, sustained change only happens when we truly have fellowship, when we're really with our folks. And again, kind of going back to that table, right? And like really developing a wider and wider sense of who's invited at the table, who's not invited at the table, what are we cooking, what's right. And you know, also in Zen we talk about the supreme meal is one of compassion. And so, and for me, that's the only way to do that is in community and building community. And so it's so interesting, you know, when we're thinking about this fellowship and thinking about, like, well, who? Who? And of course, we thought about Cynthia and Jasmine. Thinking about that you can't just have the same people. Meaning you can't just have doctors teaching doctors. We need sociologists, we need community activists, we need poets. We have these two amazing poets. We have, you know, all kinds of folks coming to do the work of what does it mean to be in community. And we had this kickoff that we missed you, Jasmine, but and also the faculty themselves were talking about, well, I'm longing for fellowship too.
That's right.
I want to just come to these times together so that I can learn, so I can, you know, actually learn how to step back from the teaching seat and just learn, you know, and how wonderful to really be in fellowship together.
Koshin, could I just add as they say, kind of put a pin in where you just directed us? And I think it's tremendously important to note that one of the things I believe that we all need, certainly there are many things that we have in common, and that is to have a safe space. A safe space, a space where clinicians and activists and poets and Zen masters and people from all genres and colors and spectrums of life can have a sense that this space is safe for me, and that people will not judge me because of anything, but are willing and open to listen. And I just simply say that what you all have done in bringing us together is you're creating that safe space. If you really think about it, how many spaces can you think of where that really exists? I mean, it's something to talk about, contemplate. That's something to contemplate. There really aren't many safe spaces where people of Christian background can come together with Zen Buddhists, and can come together with atheists, and can come together with clinicians and people of all color and gender and background, and say, I know this is safe because I know these folks won't judge me.
I wanted to put something out into the conversation, or out into the room, and that is that we're speaking this evening to physicians and clinicians, and it's not about pointing a finger at all at clinicians and physicians. This approach to care is worldwide. It's for everyone. It's for all the people that you just mentioned, Cynthia. It's for everyone. It's not just clinicians that need this program, that need this training and approach to care, because, you know, I think oftentimes doctors get a bad rap, and that's not what we're doing here. Yes, there is unconscious bias in the healthcare system. There's unconscious bias everywhere. There's unconscious bias in Zen.
In the deli.
In the deli, there's unconscious bias. So this is by no means in any way to be dogging the healthcare system. It's just looking at the facts. You know, we do have unconscious bias. We do have certain opportunities to not be fully present to another person. So, but it's not doctors that we're focusing on this evening in this conversation. I just want to make sure that we all appreciate the work, the hard work, the training, the love, the joy, the work that they put into where they are right now in their life.
Yeah, we're here because we love doctors, actually.
And we want to share the wealth.
And want to, as our friend Ross Gay, who's one of the poets from the faculty, who he said, you know, we were talking about, like, what's the kind of fabric we need to swaddle this group? To me, it's like we're all part of this fabric. You know, as Chodo is saying, like, that we're not saying that we think that everybody could use this, right? And that's why we're participating, also because we need it too. And because I know for sure it makes my life so much richer when, as you're saying, Cynthia, we're in this safe space and courageous space where we can have these kinds of conversations. And the reasons why we're starting with doctors is because as many of our doctor friends remind us, it's the most unhealthy profession there is. The highest rates of death by suicide, the highest rates of drug and alcohol abuse, and also people leaving the profession because they just don't know what to do. And actually, someone that I was talking to about the fellowship said, you know, I think I need to do that because either too many of my friends have killed themselves or left the profession. So clearly we have to do something different.
What is it? Oh, sorry. Go ahead.
Really quickly, it's just an analogy that I thought of as you all were speaking, that we're talking about that everyone needs, you know, these safe spaces to have conversations, to find community. And I'll do it because my mom wouldn't, but that's essentially what is so powerful about the work that the Alameda County Carolines does, the ACCA, which she leads, is that she is creating, the ACCA is essentially returning to community in our communities, is saying, you know, to persons needing care, people experiencing long-term illnesses, we will create community for you and help you navigate to resources that you need, but create a safe space for you to have with, you know, a community member, someone who looks like you from your community, to have a conversation perhaps about your hopes and your fears with relationship to not just your, you know, healthcare experience, but your life. Like that is the thread. So it yet absolutely is not only doctors who need it. And the ACCA is a model of folks that are bringing that to communities as well. We're trying to do that actively.
What is happening there in Alameda?
Tell us.
So the Care Alliance is really a group of tremendously dedicated people that we refer to as community care navigators. These are non-medical individuals, although we do have some that may be retired nurses or social workers. But typically they're individuals that just have a real compassionate desire to help people, to walk alongside people that are dealing with chronic illnesses, serious illnesses, up to end of life. And so what we do is provide support, navigation support to both persons needing care. We think language is important. We don't really refer to them as patients. We refer to them as persons that in need of care, and also their caregivers. And so we don't leave those important caregivers out of the space, because they are an important part of the community of that person that's dealing with this chronic illness or serious illness. And so this is a non-medical model, but it's so important that we partner with health systems and academic institutions. Health systems, obviously, because they have the patients that come to the hospital settings. For low income and underserved communities, individuals may, for example, be discharged from a hospital setting, but once they go back home, in terms of the resources that they need, you know, socialization issues, of course, pre-COVID, but more so during COVID. Honestly, people are so isolated. So we provide what we refer to as this holistic approach to care, where mind, body, and spirit are embraced. And that spirit part is really exactly what you said, Chodo. It's what brings meaning, what brings joy to an individual's life. And many will say my religion, or say I love music, I love to dance, whatever it means for them. Then we are really trained to be true listeners. And I say often to our team that listening is spiritual. To really be present with someone and truly hear and listen to what they're saying, it allows a certain kind of connection that is almost undescribable, because people know that you care. So what we hope to do is to take this model of care where there are more hands on deck, there are more individuals that are compassionate, that do have the the willingness to be trained in this space, and then kind of deploy them out there in the world. And can I say this? Acknowledging also the importance of culture.
Uh-huh.
Culture is important, whether you're Jewish, Italian, African American, German, Greek, whatever your background is, for you, that cultural background is so, so very significant. And we're trained to honor that through spiritual listening.
We have on our advisory council, we have a doctor, we have a couple of doctors, but we have one doctor in particular who's director of Paley Care at a major hospital here in New York. And every morning, his doctors and his nurses sit around the table and they begin every morning with meditation, with 5 minutes of silence, just to bring them into the day, notice where their breath is, notice what they're bringing into the room, and then they go off and do their day. And then once every couple of weeks, I think it is, or once a month, they sit and they read the names of the persons they were caring for who have died, honoring the lives and the deaths of these people, so of these persons. So sitting around as a group of clinicians, physicians, social workers, and nurses, just really, really honoring not only the work that they do, but the work that they've done in family situations and the work of the family members who were there day and night, taking care of their daughters, their spouses, their sons, their siblings. I mean, it's just a beautiful, I think, approach to, as you said, Cynthia, this holistic view. It's not just when the patient comes in, we take care of them and they leave. It's like, no, who else is in the room? The family's in the room. And also, when a patient is lost, when a patient dies, so often the nurses are not even cared for. How was that for you? You take care of this patient for the last 6 weeks, 7 weeks, whatever it is. How are you feeling at the loss? So this doctor on our advisory council, they question that. They invite that into the room. How was it for you to lose that person after so long? So,
And to tell stories.
to
about
tell
that
stories,
person.
right?
Even for a few minutes, to honor that this person lived.
Absolutely.
I'm so curious about a lot of things, but one of them in particular is, how do we show up? To me, one of the things that's so beautiful about your work in Alameda, and it's so moving because it's very similar to what we do here, and you're doing it in a different way, of course, and which is so exciting. But it's almost like you're teaching the community to remember to show up for each other. I don't know if that's accurate, but it feels, and please tell me if it's not, but I feel like in many ways, our friend Marie often talks about, raising children or dying even, is like that we have been doing this as a species for a long time. And we have to help each other through community, in community. How to teach each other how to remember, like to remember what has been torn, like the fabric of culture, if you're talking about Cynthia, has been torn, and it's been torn across racial lines, across, in particular, generational lines. Like here we're in the little island of Manhattan, and just in our neighborhood of Chelsea, there's 17,000 seniors living alone over 70, just in our little neighborhood. It's like 7 blocks. And so how do we remember how to show up? And that was actually something that we were doing during COVID, was partnering with community-based organizations and learning how to show up for those elders in our community, and partnering with them. How do we support each other? And I'm still really curious about Jasmine, something that you said in your introduction about interrogating. So I just wondered about the relationship of community building interrogation.
So, as you were asking this question, and Mom, please correct me, but what's really interesting, it's funny you pulled those two words out together. So what the ACCA, I think, gets really right is it went and found those cultural systems that already existed and put some resources behind them and built them up and strengthened them. So for example, the ACCA started as a coalition, as a partnership between churches in the Bay Area. Now, for those of you who have any familiarity with Black churches, there usually always is someone who leads like what is typically called like the sick and shut-in ministry, right? There's always been people who go and pray for people that are in the hospital. There are those, the mothers in the church that might cook food, prepare food for the families after someone is experiencing bereavement. These little pieces existed, but never had been. And so talk about interrogation, the ACCA did something really wise and to say, we already have these systems in our community. Let's zoom in. Let's provide those folks with some resources, some training on, what are resources that they can extend even beyond the walls of just their church? What are other partnering organizations that they can connect to? How can they work to honor people's faith traditions and those who aren't connected necessarily to the church? But it is an interesting point around, is it reminding people of community, or is it finding the pieces that aren't really incentivized at present in our society and saying, that's exactly what we're talking about, like more of that. How can we strengthen that already existing tendency? And what I find, and I'll stop talking, Mom, about literally your work, but
no, your work as well.
what I find so fascinating is that there are trained and paid staff persons, and that's really important. And there's this incredible network of volunteers who just do it, who come to trainings and who want to participate and want the knowledge and want to support. And it is just the addition of these few little resources that kind of exploded what already existed. And so, yeah, when I say as a researcher that I'm about interrogating, inequality or social issues, it is sort of looking, Koshin, what you were saying earlier, it's simply an approach to say, there may already be a solution to this problem, or we may be talking about this in an incomplete way, and approaching these things so as not to suspect that I would already know the answer, but they already might be within the communities themselves, which I think is certainly the case with what ACCA does.
We have, thank you. We have a friend in our community here in Chelsea, and during COVID, one of many who turned to helping the healthcare frontline workers. And on their block is the EMT station, where the ambulances are parked. And they were working 18-hour shifts. And this friend of ours organized a bake. So each person in the block would cook meals for I think there were 12 or 15 of them. They would get together and cook meals for the EMT workers. And out of that, someone said, why don't we try to raise money for these guys? Mm-hmm. Pay for their meals. So they raised $35,000, right? Mm. But not only did they raise the money to pay the restaurants in turn said, we don't want the money. Let's just cook, especially for these EMT workers. I mean, unbelievable. Mm. They used the $35,000 to donate to other services that needed the money, like food services, food pantries.
For people who are having no access to food.
Yeah. So we do know how to do this.
Yes.
In ancient times, 100 years ago and before that, someone died in the community, the whole community rallied around. Someone needed to be taken care of. Someone was living alone. The neighbors would take care of them. So we know how to do it. We've just forgotten in our culture because it's not seen as useful anymore.
And wouldn't you argue that, Chodo, given that we do know how to do this, that we begin to really focus in on a reprioritization of what's really important? I mean, I think it goes back to our conversation when we began and we started talking really about just the depth of what it means to be a human being, the humanity that connects us all. And if we really think from the perspective of our own personal needs and desires, but those that are less fortunate, and getting back to, as we serve and connect with others, we really do serve our own selves by being present and by giving. It's an amazing concept, and it's so basic, and we tend to forget it. But my goodness, if we could begin to revisit it, and I happen to think that one of the lessons that I certainly learned, even I think at another level, was that simple fact that during COVID, I began to see signs and shadows of people recognizing, I'm not going to fight over toilet paper and paper towels anymore. This is trite. I really do need to be paying attention that people are really suffering, and I have more to give, and I can give in my own unique ways. And so it really gets us back to what we already know. We just need to reprioritize what's important.
We opening up the Q&A. I think we're getting the signal from David, Cynthia, and Jasmine.
Yes, Chodo, good intuition. We do have some questions and share them here with you. So one question from Marcy, someone named Marcy. How do you see changing the litigious culture or healing the relationships between doctors and their patients? Patients, in quotes, want to lay blame for everything, not only malpractice, but their unhappiness or not having their expectations met. It seems to be linked to our healthcare system, that it's so expensive and that people who are actually injured need to sue just to care for themselves or their loved ones.
Wow, who wants to start with that one?
Ooh, Jasmine.
What I love, I'm looking at the text of this question. What I loved about the way that you asked, I lost it, there it is that towards the end, you have this sentence that seems to be linked to our healthcare system. I love that you have I love and really admire, Marcy, that you're developing like this inquiry on like, what are folks experiencing that would bring them to this place of frustration and defensiveness, perhaps. Because I think that you hit on something that's probably very right for many people. This is a very expensive bureaucratic system. People are not speaking to me nicely. And, I don't want to get off on a tangent, but I've done work with, for example, domestic violence survivors. And the hospital, and many times, can be a system that, because of connections to other systems, long story short, I can tell you harrowing stories when talking about implicit or just explicit racism, where children are separated from their families and sent into child services. Like these systems have so much power. And I'm so grateful for those that are coming to this space to think and contemplate all the levels of both the responsibility and also the way we can be more compassionate in that, because I think it is naturally a system that causes one to be a bit defensive. And I think you're spot on that there are many inequities that would cause folks, but I can't speak for everyone. But what I love is that what you did at the end of your question is trying to understand their perspective. And I think that on a person basis, what we're talking about here, that's a winning strategy. Like, that's a very disarming approach to try to understand what the person's experience has been like in this system, how they feel that they've been treated, to get under what I think you're saying you're experiencing is that people, I'm putting your question in my own language, like, people are coming at you crazy. Like, what? Why are you coming at me like this? And so like, trying to understand, like, recognizing that just as, we can make assumptions about the folks that we serve, they make assumptions oftentimes about you and about your alliance and allegiance to a system that isn't often very fair to them. And so creating the space to be curious about how they landed to that conclusion, perhaps about their experience with you. But that's all I'm reflecting on with that question.
I'd like to jump in really quickly because thank you, Jasmine. I align with your thinking on that. And I would thank you for that question, Marcy. If I were to think about potential solutions to that issue of, how do we change that culture between the relationships between the patients and the doctors and malpractice and all of that goes into that. When we, again, think about community, I think about leadership. I think about who are the identified, respected leaders within communities. One of the things that we're doing in the ACCA is bringing pastors and physicians together for informal dinners. The opportunity to come together to get to know one another as individuals, to recognize, as I often tell them, that you all have more in common than you know. First and foremost, people think that both of you are God, which we know is not true. And they identify with that. They chuckle because they know that there's this such high level of esteem that people hold both pastor, faith leaders, as well as physicians, clinicians. So having them, those two constituents come together, but also to consider having true, I don't want to use the word advisory boards because it's, to me, it's so cliche and almost boring at this point, but to bring leaders together within community to do the hard work in identifying who are those change agents within community that are respected, and then having them come into the system in a way that there's this collaborative relationship that happens and they become true advisors, true relational beings that help people outside of the system know that there is true care here, that you've done the extra legwork. It takes the stretching of systems and thinking outside of the box in those kinds of ways, I think, that help build relationship. And isn't that what we're talking about? We're talking about tearing down these walls and recognizing that we have common humanity, and it does exist, and we can find it if we take the time and the energy and the hard work and the courage to do so.
I think, thank you both so much. I would love to, both of you, to look at this question from Gary, because it speaks exactly to what you were just talking about, Jasmine. How do we bring individual focused groups that are only often individual focused and bring them into the larger community? I think this really speaks to, it's not only DEI work, but this particular topic is about DEI work. How do you see someone in the program, the tools that they would get from this program, exactly by what you're talking about right now? If I'm making sense.
Mm-hmm.
It's such an
I really love that question. So how might the program, the wellness can only happen in community? Yeah. Yeah, I really appreciate this question. And what I really like about it is what I think many of us are starting to see, that the intuition of saying, we're going to have a diversity program is a little bit off because it's not interrelated with like the other things we do on a day-to-day. And so therefore it begins up feeling, back to the other question, a bit litigious. Like it becomes about the legal, like, refer to these populations, like, like that's not what we're talking about at all. We're talking about, yeah, I really like that you're bringing it back to the wellness programs or other initiatives that systems might have. And so part of what in my work we begin to reframe in thinking through is what we now call diversity work, equity work, inclusion work, justice work, anti-racism work. How can it be everyone's business? How can it not be siloed into the advisory committee? That might be a thing. We're gonna like talk bad about advisory committee. My advisory committees are fine, but how to not be siloed into something that 2-3 people think about and bring to the rest of the hospital or the healthcare system. But how can it really be everyone's business? How can we challenge people, incentivize people to be creative on, okay, great, your work is in, I work a lot with companies and corporations, people who think about product design. It's like, okay, great. What does equity look like here? Like, how do we encourage and inspire those conversations to make it everyone's business rather than, because I think it really does get into really like a HR legal framework, which is so far from the goal that we're trying to accomplish here. The last part of your question is graduating with more tools and language. And so as we're so grateful to be.
Well, it looks like Jasmine has to step away momentarily. But I also want to honor your question. I'm not sure how to correctly pronounce your first name, Garib. Please forgive me if I just annihilated your name. Unfortunately, sometimes I don't pronounce words very clearly. But I want to honor and acknowledge the fact that you recognize the we in wellness. I like that you called that out. And the fact that the acknowledgement that community really is where it's at. I hope I'm not bursting anybody's bubble. Community is where people live. It's where they breathe. It's where they engage. They go to the health system because they're not well, right? But where they live and where they thrive and they choose to be is in community. And I think if we think from that framework, that let's go where people want to be. In other words, for them, that's that safe space. For them, community represents a sense of belonging. For them, community represents the sense that I'm cared for. So how do we get health systems and individuals that are deeply engaged in the wellness of individuals to come into community in ways that allow people to feel that they're truly acknowledged for who they are and not they're this, oh, I don't really know about those people and the food that they eat or how they look or the way they do what they do. So what we're really saying is we have to be willing to be stretched and to step out of the comfort zone. But that is really where wellness, I believe, and this holistic approach that we've been talking about to true care begins. So I know this is radical, but I know that there's a place for this. And we're seeing a lot of positive interaction between the health systems and community because certain individuals within these health systems are saying, I want to be there. I want to be a part of your community. Thank you for honoring me to participate in your community. It's a sense of humility. What a word. Humility.
No, I also so appreciate the question and the we, and I feel like that goes back to the table, right? And who's invited, who's not, who's missing from the table, and how do we reach out to them? And I know that also there was someone wrote about how do we get the higher ups to listen? Well, I think by having conversations and actually learning how to support one another is the place to begin, because if we don't have our people, we're not going to be able to really make much change. So we have to really, in my experience, really sustain so that I feel like I have a circle of people and I can have people to talk to, real peers, real connection, and real fellowship. And so to me, like if we're not also, it's, as we've been talking about it, kind of the focus on exteriorizing the change, but we also have to also work with it, our interiority, and make sure that we're nourished, we're eating the food too. So we're passing across the table and also we're receiving it from another. So giving and receiving equally. So.
Yes.
David.
Yotzi.
Cynthia, Jasmine, Koshin, Chodo, thank you so much. This is one of those moments where I regret having to play timekeeper and share that we're at time here. I want to give you a few moments for any closing remarks, but first maybe I'll just mention to people about the fellowship for physicians, nurse practitioners, and physician assistants, the Contemplative Medicine Fellowship. Koshin Chodo and Tirona Lodog, MD, are serving as guiding teachers, and we have a visiting faculty of 16, as we talked about. Jasmine and Cynthia, two of those. And yes, we're very excited about it. And so that application for that is due July 2nd. If you are interested, we encourage you to apply as soon as possible. We are close to our limit of the number of people we're taking for this inaugural fellowship. So we hope to see you applying. And then for those who aren't in one of those professions, we have a program called Foundations in Contemplative Care, a 9-month program for clinicians or other professions or people of no current profession who are interested in exploring their relationship through their relationship to spiritual care through the contemplative approach. And I'll also just acknowledge and apologize that we weren't able to get to everyone's questions. Thank you for submitting them. We will capture the chat here, and if people have questions that we weren't able to answer through that, we'll get back to you through email. So Chodo, Koshin, Jasmine, Cynthia, any closing remarks?
Jasmine.
So I'm so grateful to be here. My fire alarm decided to go off. That was cool. That's because we were having such a brilliant, fiery conversation. But quite honestly, I'm so inspired by the questions y'all asked because you all are helping me to think through, what does it mean to do both anti-racism work, in our spaces, and also what does that look like internally, right? How do we use that as a restorative practice? Because what we're asking folks to do with anti-racism work is to listen more, is to suspend bias, is to do all these things. Like, what does that mean to turn those tools onto yourself? And how is that liberatory? How much more listening, internal listening, do you need to? And so I really love where this conversation is going. Looking forward to continuing with the rest of the fellowship.
Sure. I'm just, it's just a profound honor for me to be able to be doing this work, to be engaged in this work, and to be able to see the change that we're already manifesting here in the city and integrative medicine fellowships that we've served in across the country, to see clinicians that thought they could never change the system, that it would never ever be different, but it actually is. It's changing slowly, and we know that from the work that we've been doing both here and in Japan, that people, the clinicians, doctors, and the higher ups, actually, someone mentioned the higher ups, are beginning to listen. To me, that's a thrill. And then to be able to have people such as yourself, Cynthia and Jasmine, as part of this change, it's just beyond exciting for me. And this is being our inaugural cohort. I think it's going to be just pretty amazing, pretty fiery. Yeah. The bombs will be going off. Cynthia.
Well, I can't say thank you enough, just for the incredible opportunity to engage in this conversation with all of you. Hats off, kudos to the wonderful audience participants that are just a part of this fellowship. I'm just thrilled to my bones, because I know it takes people like you to see the need, the value of this, and then to begin to practice in our own ways, in our own places where we are, that really can start moving the needle continually in the direction that we all so much want to see happen. What do they say about be the change that you want to see? And so thank you so very much. I'm humbled and grateful for this opportunity, and look forward to our continued conversations.
And I just want to thank David Yotzi and Mayor Hasid for taking care of us in the community, and also just really appreciating Chodo and Jasmine and Cynthia. I just love the love circle. Look forward to dinner. And but really, it's, to me, really, how do we each, Maizumi Roshi, one of the founders of our school, talked about that I'm responsible, you're responsible. So how do we really dig into the joy of responsibility? Because for me, the more I get into that responsibility and take it on fully, then I'm participating fully, and I can actually also receive fully. So I'm just totally feel very loving, very tender, and joyful. And thank you all so much. Wow.
Take care, everyone.
Thank you.
Good morning, good night, good afternoon. Cynthia and Jasmine, look forward to seeing you very soon.
Very
Thank you so much.
Congratulations, Jasmine, Dr.
Thank you. Thank you again.
Dr. Jasmine Diana
Yeah, great.
And congratulations, Cynthia, on your daughter's achievement.
Well, thank you very much. We're very proud of her. Thank you.
Good night, everyone, or good
Thank you all.
depending on where you are.
Good night.
And thank you all for joining us.
Thank you, David. Thank you, Meyer. Thank you, Chodo.